Good afternoon and welcome to today's Georgetown Alumni webinar hosted by the Georgetown University Alumni Association. Thank you for taking time out of your day to connect virtually with fellow Hoyas for today's program, Pandemic Parenting, Managing Children's Emotional Well-Being with Dr. Bill Lacamelli, hosted by Julia Farr, Executive Director of the Georgetown University Alumni Association. I'm Kelly Young, Associate Director of Strategic Engagement and Alumni Relations, and I'll be facilitating today's program. Before we get started, I'd like to share a few tips and reminders. This webinar is being recorded and the recording will be made available on our YouTube channel within 48 hours of today's broadcast. You will also receive a link to the recording in our follow-up email. Within your GoToWebinar control panel, you should see a handout section. There you will find and be able to download a PDF which includes Dr. Licamelli's summary as well as recommended resources and further reading. Dr. Licamelli will answer audience questions towards the end of the presentation. Please send in your questions using the questions section of the GoToWebinar control panel. If you're having any technical difficulties or other issues, please also submit those concerns via the question section of your control panel. Without further ado, I'm pleased to turn things over to Julia Farr.
Thank you, Kelly. Hello, and welcome to all of you from here in the heart of Georgetown. I'm excited to welcome our guest today, Dr. Bill Lacamelli, a well-known member of our Alumni Association Board of Governors, an avid Hoya sports fan and volunteer. Bill is a retired child and adolescent psychiatrist who practiced for over 38 years. He was also a clinical professor of psychiatry and pediatrics at Georgetown University School of Medicine, served as the director of Child and Adolescent Psychiatry at Georgetown University for nearly 14 years, and was director of the Georgetown University's Tourette Syndrome Clinic. Bill is a graduate of the college as well as Georgetown School of Medicine and completed his psychiatric residency and fellowship in Child and Adolescent Psychiatry at MedStar Georgetown University Hospital. Bill, it's really wonderful to see you again, and thank you for taking the time to speak to our community today about this important subject. As a parent myself, this past year has been and continues to be a time of incredible challenge. Navigating the upheaval of these past few months with my own children has certainly been challenging, to say the least. They're older, they're 24, 21, and 18, but they've all experienced this ongoing anxiety about the very uncertainty of the pandemic and its disruption in their school and their work and their celebrations and in their community. And then we all had that close living together for several months together that I know so many of us have done. So Bill, please tell us what impact you're seeing with our children and what we as parents can do now to help them through.
Okay, thank you very much, Julie. A pleasure to be here. And I just want to thank everybody at the Alumni Association, Kelly, Bridget, and you, Julie, for this, but also for the work you all do in terms of helping our alums and the community cope with COVID, Black Lives Matter, the funds that are run for students about COVID, the funds that are run by MedStar to raise money for the staff that's been impacted. And also the way Georgetown has handled this. Georgetown with their students tried to get kids on campus but couldn't do that. And they're really emphasizing safety for faculty and everyone. And in addition, things like the medical students who, despite their busy workload, we're bringing toilet paper and food supplies to the community. So very proud of Georgetown and its service commitment. The other thing, some prayers and thoughts out there for anybody who's lost someone from COVID, or for the maybe single parents who don't have a lot of resources, maybe lost a job and trying to struggle with dealing with virtual teaching. So before we get started, I'd like to do a couple of polls. The first is just to, if Kelly could put it on, it's basically just to look at what the audience is and who you are. And if you could just use the poll, whether you're a parent, educational professional, mental health professional, or clergy, other healthcare provider, or other. And if you could do that now and just sign in to who I'm talking to, and then we'll do the second one. If we could take a minute to do that. Okay.
Bill, here are the results to your first poll.
Okay, so 87% parents, educational professional 4%, mental health 4%, other healthcare 2%, and other. If we could do the second one, and that is looking at how the COVID has impacted on you. Has it affected you in any of the ways? Your work, going to school virtually, financial hardship, cared for or lost a loved one with COVID, or minimally impacted by the pandemic? We just put that in and we take a look at that to see how it's been affecting the group. Okay, so now we're going to go to school virtually, 96%, financial hardship, 13%, cared for a loved one or lost somebody, 8% are minimally impacted. Okay, if we could end the poll. I forgot to thank two people. One is my wife. I'm supposedly the expert on all of this stuff and development and effect, but it's really my wife who my kids go to for the real advice. And secondly, my daughter, who has two young children, I have two grandchildren that she has at age 7 and 5, who's been very helpful at explaining to me what it's like to be a working parent and dealing with young kids and their anxieties. You know, when I decided to talk about this, my daughter also mentioned, Dad, she said, don't forget the positives. And one positive is, imagine if this happened 15, 20 years ago with no internet. Imagine, we talked about school being virtual and work being virtual, there would be no school and no work. And the other thing, and again, my daughter points this out to me a lot, this has been a time to sort of stay back, reevaluate your life, smell the roses, go out and look, you know, in the yard for worms with your kids, bake with your kids, play Monopoly games or games that have never been played before, and maybe use Zoom to connect with people like we haven't been able to do before. You know, when I decided to talk about this, there weren't a lot of studies. We had thoughts about how does this affect kids? How does it affect families? And lo and behold, September 13th, came out in Pediatrics, a study by Gassman and Pines that looked at the effect of COVID. And it was very interesting because they had an ongoing study, and the study looked at low-income service workers, 50% Black, 30% Latino, and they looked at the stressors they had and the kind of hardships they have, and they qualified that. And then they looked, and this is pre-COVID, and then they looked at the effect on the parents and the children in terms of anxiety, depression, functioning. And lo and behold, they had this ongoing study, and it came along to COVID. And they were able to go back to these people, and they looked at that point primarily younger children. It was parents who had these low service jobs in a low income community, and they looked at the number of stresses like income loss, childcare problems, et cetera, food instability, and they measured those. And lo and behold, in the pre-COVID group, obviously the more of these insufficiencies that they had and the stresses they were dealing with, the higher the rate of parent and child difficulties. And then they were able to look at this group after COVID, and same association. The more of these 3 or 4 things that they were dealing with, the more of the problems, except after COVID, they had gone up in some places by 30, 40%. So that was one study that was done. And we're starting to get more data. There was also a study that I found out this morning at 6 o'clock. Anna Johnson, Dr. Johnson, in the Child Development and Social Policy Lab has a program called SEED. Well, they were doing a similar thing. In Oklahoma, they were looking at kids long-term, starting at a very young age till like 3rd grade, and finding, again, the social inadequacies, the environmental difficulties, and how that affects teachers, and also how it affects the kids. And luckily, since the study was going on, they were able to continue that and go back and look at a subgroup of kids and teachers. 2 interesting findings. 46% of the teachers in those neighborhoods, the poorer neighborhoods and the poorer school systems, 46%, they were teaching virtually but had kids at home doing virtual learning. And the other part was that they found that, very interesting, 29% of the teachers, only 29% of the teachers reported that most of the kids were attending class most of the time. So one of the problems with the virtual learning is getting to see if kids attend. Okay, so what I'd like to do is, since we don't have a lot of data about COVID, I'm going to talk about some developmental issues, and those developmental issues that might help us explain how we might approach dealing with any stress and the COVID and other stresses. One is children's reaction to illness and hospitalization. And there's a paper link that I wrote many years ago that goes over some of the developmental issues. The next one is children and death. The next one is PTSD, post-traumatic stress. And then I'm going to try at the end to compile that and use that to try to understand how we might approach COVID. In terms of illness and hospitalization, 30 to 40% of all children and adolescents have a chronic physical illness. 7 to 10%, it's more serious. And some of the things you want to try to understand is that there's specific stages kids go through. So a 6-month-old, if they're sick, may need to be cared for, cuddled, whatever. Whereas an 18-year-old teenager, if they develop cancer, or they lose their hair, they're worried about their life and their love life and forming relationships, trying to form their identity. Some of the specific defenses or ways we cope with this with kids, one is regression. If you have a 5-year-old and they've lost a parent or there's some stress about school, they regress, and that's normal for a period of time. That means that the 5-year-old may not be toilet trained anymore or may refuse food. Another way that kids cope is turning passive into active. And basically that means getting some control in their life, doing something to deal with. An example of that, a kid goes to the doctor, they get a shot, and they come home and they're upset. And the 4 or 5-year-old, you may ask them how they're feeling, but kids at that age use play. And one of the things and one of the ways they may cope is they may turn passive into active. They may get a doll and they play doctor and they're the ones who are giving the shot. So with kids, it's important that you realize, especially younger children, 3, 4, 5, 6, 7, and even older kids sometimes, they use play, drawings, art to cope. Now, we know in thinking, the guy named Piaget that you may or may not have heard of, he studied the thinking of children and the development of that through time. And 2 of the stages he talks about are pre-operational thinking, and that's the 4, 5, 6-year-old. That kind of thinking is black or white, all or none. It's very egocentric. If daddy dies, it was because I did something wrong. It's magical. Whereas at 7 or 8, you start to develop what we call concrete operations. It's much more reversible, much more understanding of the varieties of things. Well, 2 guys named Stewart and Ragabuto did a study, very simple study, and they gave a stethoscope to the 3, 4, 5-year-olds and to the 8-year-olds. And lo and behold, when they asked them what that did, the 3 or 4-year-olds said, well, you're alive or dead, black or white. 7 or 8-year-olds, it determines, is your heart working okay? Is the rhythm all right? It helps the doctor. Same thing with blood drawing. They did a syringe and blood drawing equipment and they asked the kids, and lo and behold, the older kids kind of understood about blood. 3 or 4-year-olds, I'm afraid you're going to take all my blood because they don't know you have 6 quarts of blood. So one of the things you want to do in all of this, whether it's illness or other things, don't adultomorphize. Don't assume, like the nurses may have assumed that the kid needed desensitization for the needle. Don't assume. Ask the child what's going on, explain it, and then ask them again. One thing that comes out in all of these studies, and especially with illness, but in any stress, is the key to the child's reaction is the previous parent-child relationship and the parent staying calm in the crisis. And basically that means if there's a crisis or a loss or COVID or whatever else, if the parent is totally overwhelmed, you need to go and get some help somewhere, support, talk to a friend, go get a cup of coffee, get therapy, because it's how you react with that child at the moment. You could share feelings, but not to be overwhelmed with them. So how do you assess whether a child's doing well or not? Well, we need a variety of what we call defenses of coping skills. And one example is being able to use regression and being able to use denial. When they studied cancer patients, denial used to be a bad thing. You deny. Well, actually, denial is very useful sometimes to be able to cope. So you need flexible coping skills. And I'll give you an example of the regression and denial. If you have juvenile rheumatoid arthritis and you have a very sore joint, and you go to the doctor and he says, look, you got to regress. Basically, you got to become dependent. You can't use that arm. Somebody has to feed you. Somebody will carry your books to school. So that's what you need to do and accept that. On the other hand, If there's a hot joint and the doctor says, now you really got to exercise it, you need to deny the pain, deny the feelings. So you need a balance and flexibility of those ways of coping. And you always need to keep routine along with dealing with feelings. Any suggestions around dealing with illness or any stress is to try to make passive into active, give some control. If it's your child at home on virtual learning, have them make up part of the schedule. If it's an adolescent in the hospital, do you want peas or corn? Anything to have some sense of control. You always need to hear the fears and then reassure. Don't immediately say everything's going to be all right. Okay, hear what the question is, hear what the worry is. It may not be what you're thinking. There was a study of the Sidney Farber Institute on cancer patients, and again, very interesting. Number one, a lot of those kids cope well despite all the illness and chemotherapy. Number two, they wanted facts with hope. And number three, surprise, passive turned active, they wanted to join the doctors and their parents in the fight against cancer. So they had some sense of being active and not just being helpless. All right, a little bit about child and death, and children and death and dealing with death, and that's their own death, that's parents' deaths, that's neighbors, friends. If a child says, am I gonna die or is daddy gonna die? You need to ask again, what do you mean? What are you thinking about? Does that mean they're scared? That means they're gonna be lonely? If they're a 3 or 4 year old, they're guilty. Did they do something to cause it? What's the question? Ask, tell, and ask, okay? Parent death occurs in about 5% of all children under the age of 18. We don't have a lot of studies on child bereavement. We do know Rutter studied children that had lost a parent, followed them up 5 years later, and there was more depression, anxiety than the control population. How can we help deal with anxiety about death? One thing with younger kids is you could use the example of animals, use books. Librarians are very good with telling you what kind of book will help for the angry child, the parent loss, dealing with that. There's one book that I listed in there by Judith Fjorst called The 10th Good Thing About Barney, which basically uses the death of, I think, a cat to explain to a child about what they believe in death and how they cope. One thing, Kubler-Ross, who studied death, talked about the different stages of death, and there's 2 interesting points about that. He started talking about death and the stages that people may go through, basically because she was on rounds with a bunch of doctors and medical students and residents in the hospital, and she noticed when a patient was dying, they didn't stop in there so much. At a point when they're most needed, okay, and the human contact is most needed, and that made the patients feel disconnected. So you need to be able to listen to things about death. With child psychiatry, we say in the psychiatry, there's 3 things people don't like to talk about. Okay, death, money, and sex, and there's probably some truth in that. So don't run away from it. The other point that is important with children is that people may be at different stages in dealing with death. Let's say a mother loses her spouse, and they may be angry and depressed, and the 3 or 4 year old child may be angry and depressed and missing dad for a few days, and then wants to play with his friends, isn't happy. You need to understand that people may be in different stages, and you need to respect that and not get upset with that, but understand, Johnny, who's 3, is in a much different place. That there's the thing about asking the child, telling and asking again. There's an old child psychiatry story, and Johnny is with his dad, and he's 7 years old, and he's driving the car, and all of a sudden Johnny said, "Dad, where did I come from?" What does the dad do? He panics. He goes to the library, gets about 40 books, spends about 3 hours on sex education, and then Johnny says, "Well, that's fine, Dad, but Dave's from Chicago. Where am I from?" Ask the child, tell the child, ask them again. In dealing with death, it's important to remember that whatever your beliefs are about death, that people live in the memory of the people, that it becomes a part of them. I use the example when med students ask me, what's important in life? What advice do you have for young med? I quote my dad, who I always remember, and he would say, work hard and have fun every day. And the other thing he would say is, if somebody asks for change, it's only change. So that's how we remember people. Now, it's interesting. When I gave this lecture at Children's Hospital about hospitalization and death, a renowned psychiatrist, sort of the godfather of child psychiatry, wrote the Handbook of Psychiatry. At the end of the lecture, Dr. Licamele, that was a very good lecture, but how about religion? I said, oops, didn't mention religion. Well, religion is important, okay? And it's very important if there is a cultural background, a religious background, your beliefs about death, afterlife, God. It's important if it's there. If it's not there, you have to be careful. You don't want a deus ex machina, like in the theater, coming in and saying, well, we got this religion thing, we're going to talk about that, if the 5 or 6 or 7-year-olds never heard about that before. So it's important to be careful about that. And if you're Catholic and you had in your room as a child the little poem, if I should die before I wake, I pray my soul to take, I would hope you'd kind of get rid of that, okay, and talk about things, not when you're going to bed, about dying. So again, you balance talk with routine. You balance hearing the feelings and then sort of moving on. Okay, next sort of section on PTSD, post-traumatic stress disorder, which you're probably mostly aware of. There's 2 basic groups that have been studied. Most is Vietnam war vets and war vets, large studies on those. And then most of the studies on kids, and there may be more of these nowadays, but have been on abuse. So a lot of the data comes from abused children that get post-traumatic stress. Some studies have shown that throughout their life, 15 to 20% of kids have been abused or neglected, and up to 40, 50, 60% have been seen violence, either in their neighborhood or domestic violence. Some studies have showed that from 3 to 5% of kids will have PTSD. And PTSD is basically usually have precipitant, and the closer you are to the precipitant, the murder, the whatever, the worse it is. And if symptoms last for over a month, and I'll go through the symptoms, then you start worrying about, is this PTSD? There is a reliving of the events. There's nighttime and sleep disturbance. There's upset, intensity, fear, irritability, sadness, start looking always for the threat, being afraid to do things, numbness to feelings. In kids, it may come out more in play, as we talked about before. Okay, so you evaluate for PTSD, and lo and behold, what's the first thing you do? Well, there's 2 main things you do. Number 1 is you get support. Kind of hard. You get support from family, from friends, and from school with kids. And what happens when they're not in school, not seeing friends, and the family's been on top of each other? So that's tough. And the second is you try to avoid the trauma. Oops, not only COVID, but Black Lives Matter, protests, hurricanes, fires, you name it. Those are ongoing kind of problems. So it's a lot harder. But there are treatments for PTSD, behavioral therapy, child family counseling, play therapy, even sometimes medications can help. Now, in general, before we go to more specific things about COVID, again, Sunday, I'm reading the New York Times Magazine. There's an excellent article in there. I don't think we were able to link it, but it talked about, I think, the lost year of teaching. And they listed some problems and they listed some solutions. It was a group of educators, administrators, teachers talking about their experiences. Number 1, we're talking about getting kids back to school safely. Oops, poor resources in poor schools, large classes, no outdoors, no ventilation. Some teachers talked about no soap and a lack of bathrooms for kids to use. Kind of tough to go back to school safely. And then the virtual problems, no Wi-Fi, the cost of computers, no teacher training for virtual teaching, the divide between poor and private schools, lack of resources. 8 million kids is estimated did not have internet in the rural or even inner city. The poor attendance, which we talked about, lack of federal, local leadership in terms of a plan, an infrastructure plan for schools and for teachers to do this virtual stuff. It's hard on kids virtually, but imagine ADD, learning disabled kids, autistic kids. Schools are desperately trying to get them back because they need the contact even more than the average child. It's hard to teach things like science if you don't have manipulatives, although there's one science teacher in Arlington, I think, has put online some very engaging kind of science experience to engage kids. But how do you teach math? And the other thing is the teacher and the peer human contact. you know, it's very interesting. We talk about school and needing to teach, et cetera, but that human contact that now we found even more so is missed. And then in school, if you're not in school, you lose the school support, whether it's for food, and places are trying to give that to people and figure out ways for bus drivers to deliver meals, counseling, picking up abuse, and the social contact. There was one report of a poor Black, mostly Black, inner city Louisiana parish. They didn't even mandate virtual learning. Solutions. I think in this article, they talked about some very creative solutions. One which I'd never thought about, keep last year's teacher. One group said, let's keep the teachers. They were with the kids for the year, then online. Let's have them do the next year's curriculum. Clever. Resource plan, which we need, Wi-Fi, computers, etc. Also, teachers need to teach smaller little bits of things and have more group discussions. They mentioned a company, Edutopia, that has a lot of online teaching for virtual teaching and being creative. Need to use outdoor spaces. One school district did something very brave, and they got a lot of grief for it. They got daycare back first. Younger the kid, more important, but even more important, they had a lot of parents at home that were very stressed trying to do virtual training, trying also to do daycare with the younger kids. So that was their approach, which was interesting and clever. I think we need to be less data and test focused and look at the human connection, which was really lost in COVID. And it emphasized that school isn't just facts and figures and tests, it's also the human contact and the socialization that occurs. Okay, so stress, how do we apply this to COVID? Well, this isn't just COVID. As I said, there's hurricanes and fires and asteroids come in the day before the election. And if you look up in the sky in Washington, you see what looks like haze. It's smoke from the fires out west. So kids are supposed to be active. And if you have a child and they're sitting in class, you need recess, not just to be healthy, but to get out and move around. Well, how about the stress this summer? Most kids, okay, no camps, no vacations, no sports. So we need to think of how do we balance routine with dealing with feelings, especially in a virtual environment. Well, routine, you need a routine around sleep, around eating, around chores, space to work that's organized. You need a schedule. You need to have some fun things that are in there, like baking. You need to get some exercise and have recess. Ideally, you know, I'm talking about this stuff, and if you're a single parent at home and don't have a job, not so easy. You have to try to arrange visits with friends, whether it's a small pod to go on a field trip or Zooming visit. And then how do you balance the feelings? Again, use play and stories and younger kids' art. The adults have to take care of themselves, as I talked about. Key predictor of how the child does is how the adult does. You know, if you need help, get some help so you could be there to be calm for your kids. You need to be honest, but have hope. You need to hear feelings, but don't immediately reassure. Oh, that's going to be all better. It'll be all right. Daddy's in the hospital, be home. Well, don't say that unless it's true. Don't adultomorphize. Remember Johnny and Johnny asking about where he came from. Ask, tell, ask. Make sure you listen. And if kids are going back to school, and that may be frightening, actually talk about it. Address the feelings. A kid may be afraid, what happens if somebody's not wearing a mask? You could role play. You can go through some of those things in anticipation. There's some studies that actually, if college kids role play what it's going to be like to have a new roommate, et cetera, those kids do better. Well, same with the younger kids going back to school. You could ask for help. If your child is having help, you could ask the teacher. If they're having difficulties, you could ask the teacher for help, for suggestions. If you have an LD, ADD child, autistic child, schools are working their tails off to try to figure out ways to reach those kids. Reach out. Kids can keep a journal, okay? Kids can try to see friends. Key is stay calm. You could have family meetings to discuss how everybody's doing and what the plans are for the day. Parents are a model for coping. That's how we can help the kids. All right, normal versus abnormal. How do you tell, is this a problem or is this sort of a regular reaction? First off, if you're a provider, make sure you always ask the parents what's going on with their kid and what might be happening, because if you ask the parent, they usually, as good pediatricians know, they'll tell you what's going on. And Dr. Proctor Harvey used to tell the medical students, ask the patient. If you ask the patient, spend some time, you'll find out what's happening. Judy Rappaport, who was the premier researcher in child psychiatry, actually supervised me in consultation when I was a fellow. And she said, you assess what's normal or abnormal with 3 easy questions. 1, how's the family going? 2, how's friends going? And 3, how's school going? Oops, okay, family's been on top of each other. School's online, haven't seen friends. No friends, no school, not so easy. Key point about normal versus abnormal, if you're not sure, ask for help. Use some of the resources, ask somebody, meet with somebody who knows kids who can go over it with you on how you might approach it. First, I'll talk a couple issues. One is depression versus sadness versus grief. We know in studies of grief that kids can get depressed, or adults can get depressed 4, 6 weeks, 8 weeks. Physical symptoms, sleep difficulties, sadness, appetite problems, weight loss, no energy, no focusing, not being able to work. If it is longer than 4, 6, 8 weeks and not starting to get better, then it may be depression, okay? And the other thing is normal sadness can be there about not seeing friends and doing stuff, but how severe is it and does it interfere? And also in terms of depression, is there a past history that the child has had in terms of depression, as we'll talk later, anxiety, or a family history that may make you more concerned? When in doubt, ask. Anxiety, the same thing. Hesitancy, physical symptoms, shakiness, being scared, being worried. Does it interfere? Okay, how long has it been around? Does it interfere? Does it seem to be getting better? Now, you may have studied about fight or flight in your biology courses in high school. And anxiety can be helpful or not helpful. And I used to tell adolescents in my office or parents, there's good anxiety that's useful and bad anxiety that's not so useful. And the good anxiety is you're in my office and you leave my office and there's a highway and an 18-wheeler and it's going down the street and you decide, boy, I'm nervous, and you don't go in the street. That's pretty good anxiety. That's adaptive. Bad anxiety, you're in my office and you're so panicked and upset about things, you won't go and go home. You want to stay in my office because you're terrified you're going to get hit by a car. So useful and not so useful. PTSD I addressed before about the symptoms and getting help with that. The key, okay, the key in all this, if you're worried, ask for help. One good thing about this Zoom culture we're in, necessary from COVID, one very good thing is we've learned about telehealth and telemedicine. And in some ways, psychiatry, in some ways it's hard because you need that personal connection. But in some ways, one of the things that's adapted the most, because you usually don't have to do a physical exam, for instance, is mental health. So mental health treatment has been actually very good. So when in doubt, seek some help. A lot of that may be really online, and that may be an advantage here. So I will stop at that. Check the time here. So let's try to go some questions. Julie, I think you're going to moderate some questions for about 15 minutes or so. You're on mute, Julie. You're still on mute. Can you unmute?
How about now?
Good. I can hear you.
I'm not doing anything. Someone in the background's doing it for me. Thank you, Bill. It's really helpful. I want to remind everyone you can submit your questions right now for Dr. Licamele using the questions section of your GoToWebinar control panel. So please do that. We'll start with a question, Bill. Here's one. My 7-year-old cries often. He misses friends and is tired of Zoom. How can I try and keep him engaged with cyber school and connected with friends?
Okay. First thing is, what's he crying about? Okay, try to understand what is the issue. Don't assume. Okay, don't assume it's friends. Don't assume he's getting tired or whatever. Try to ask the question, what's going on? Excuse me. And then you want to talk. And the 7-year-old, you may look at their play. You may look at their art. You may draw. You may get a book at the library about dealing with anxiety, missing friends, that kind of thing. And then try to come up with some solutions, some activities, like can they do a play date virtually? And in terms of the tired of Zoom, you might talk to the teacher and say, getting tired, Some teachers will do, as happened in my family, some teachers will do a special breakout section to talk to the child, to try to engage them and be more connected. So the key thing is, what is the child asking? And then you could try to address it. The worst thing you can do, as we mentioned, is the worst thing you can do is the kids crying and saying this sucks and it's horrible and the school's awful and the teacher's awful. Remember the thing about fighting the COVID together and the adults being in charge, okay? You don't say, yeah, that school system in Arlington's horrible, it's not working. You say to the child, what are you worried about? Let's try to fix it. We'll get the adults together, okay? And you can go discuss with the teacher in the school system if you're upset or worried, but the adults fighting it together, okay? It's fighting the cancer, fighting the COVID, then that'll reassure the child. Thanks.
Great. Okay. My daughter is sometimes perfectly happy to go outside for a walk, but other times has anxiety around going outside. How should I talk with her to help her understand why it's safe to be outside?
Okay. Again, the first thing is, ask the child, tell the child that, what is it? What are they worried about? Okay. Is it the adult worry? Okay. Is it the father that's going to go do the sex education with the kid? Or is it Johnny's in Detroit? So first thing is ask about it, and then try to be realistic about, yes, a lot of people have worries, okay? And try to think of the ways to reduce that anxiety, okay? Is it better if they make sure they try to go with a friend, for instance, or somebody in the neighborhood? And the other thing in terms of anxiety, and again, my daughter mentioned this, there's a lot of resources online to reduce anxiety. One is cosmic yoga. People have heard of that. I got a 5- and 7-year-old grandchild. They use that to relax, and it's very engaging with kids. And it's relaxation, and people can also look up progressive relaxation for kids and adults, where you have coping mechanisms to calm yourself down, or even breathing exercises. So there's some practical things you could try. If that doesn't go away with those things, then you got to think, is this more than the usual? Thanks, Julie.
Excellent. What would you recommend for dealing with teenagers exhibiting risky behaviors and heavy social media use?
I'm sorry, what is it again?
What would you recommend for dealing with teenagers exhibiting risky behaviors and heavy social media use?
Okay. Again, the question would be, is this something new with COVID? Is this something that was always there, got worse? Are there other symptoms? What are the risky behaviors? Are we talking about using drugs? Are we talking about cutting themselves? You know, what are the issues in terms of how serious it is and what it might be? If it's more serious, you may need help to evaluate that. So, you know, what is the risky behavior? What is the worries? And understand too that kids also, younger kids and even adolescents, risky behavior, if it's new, may be a sign of depression. Kids don't always look sad, they may look angry. And the anger in certain kids and adolescents may be a sign of depression. So again, normal, abnormal, get some help if you're not sure.
And what do you think about the heavy social media use? I mean, this is a pandemic in a pandemic with our children, that they can't disconnect from their phones, and it happens with adults too. But
two thoughts. Think of where we'd be without the internet. Okay. All right. And the second is a neurosurgeon. There needs to be limits on screen use and screen time and television, and that needs to be there in American Pediatrics and Child Psychiatry. You need to have limits on that, and you can get addicted to it, et cetera, et cetera. However, okay, a neurosurgeon once gave a commencement address to medical students, or maybe undergrads, and he said, okay, all you parents that try to get your kids off these screen times and doing this stuff and computer games, raise your hand. He says, there's studies that good neurosurgeons in the world of robotic surgery, the best correlate was how did they do playing video games as a kid?
Yeah.
So it may be something you need to set limits on, you get preoccupied when you get addicted to, like anything else. But also, some kids who have ADD, the parents say, well, he's got ADD, he can't sit still and do work. The treatment for that is sometimes doing video stuff on the screen. And that interaction can keep them focused as opposed to inhibiting it. So you need to look at each individual case.
Thank you. Let me go back to the first part of that question. So with a teenager or older child exhibiting any sort of issues or risky behavior, what do you recommend if they refuse professional help?
Okay, good question. How old again?
Let's say teenager or older, you know, that tween stage.
First thing is you try to talk to the child, try to explain you're concerned about them. A lot of times the resistance I find when parents come in is more on the parents' side. They're worried about the child. What's he going to think? He's going to think he's. A lot of the times when the kids come in, even though they've protested, they're relieved to know that there's somebody's addressing the problem. So that's one of the first issues. The other is if a child won't go, you can go to a child psychiatrist or psychiatrist and say, I want to talk to you about my kid. And they could help you figure out a way in a program to engage that child, okay? And when you need to maybe set a limit and how you can do that in terms of insisting that they need help. You know, if a kid had acute appendicitis and he's 12 or 13-year-old, he says, I don't want to go to the hospital, you wouldn't quite agree with that, okay? You'd figure a way to deal with it. So deal with a professional that can help you figure out the way to deal with that and help you, because that happens a lot.
Because if they're under 18 years old, you as a parent can go consult with the doctor about the child.
You can consult with a doctor about anyone, okay, if you have a parent that you're worried about, if you have a spouse that you're worried about if they don't want to go. So you could do that as a step, and they will help you negotiate that, okay? And there's certain laws about which age you can insist on things.
Here's a good one. How do I stress the importance of wearing a mask to my 4-year-old without scaring her?
Well, that's a good question. Again, you talk about the importance of a mask, and this is to protect people, and doctors are telling us it's hard to be safe. And you go through that explanation, then you ask what they hear, and then you ask what the fear is. You know, are they gonna not be able to breathe? Okay, are they going? So don't adultomorphize. Don't say, well, he doesn't like a mask because whatever. It may be they're scared, they're afraid they can't breathe, their friends are going to laugh at them, and you work through that. Okay. Don't assume what it is, and then you can re-educate them and talk to them about it. Like we talked about, if a kid's afraid, what happens if I'm wearing a mask and the other kid's not wearing a mask when I go to school? Role play that in terms of how it would work.
What are some tips with infant development? It's difficult going outside and exploring the world with your newborns. Do you have any book recommendations about infant development?
T. Barry Brazelton, the old book. He's the old guy on, sort of the expert on infant development. You know, stimulate your kids, do what you can to stimulate them, and do the kind of things you normally do with kids. I don't know if I have other suggestions in that. They need stimulation and love and caring and feeding.
Absolutely. I have a 3-year-old, not me, but the person asking the question, and this year we would have enrolled him in a preschool program. We've been working closely with him for his language development. He has a bit of a decreased speech, but I'm worried that he may be a bit behind when it's time to reopen in-person learning environments. I don't want to rub my anxiety off on him, but I want to bring him up to speed. How should I approach keeping him on track as we balance life and preschooling at home?
Okay. I think, again, I'd reach out. You know, most schools provide preschool services, and if you have a worry about language, okay, there may be resources in the school. You may be able to consult online with a speech and language therapist to get some help on how you could do that, what kind of programs you could do to get them to catch up, that kind of thing. So again, if you don't have the expertise, and that's not my expertise in terms of language development, reach out. Okay, the people are there, and people are very adapted to working in Zoom, and they may be able to come up with some very practical suggestions. So you don't have to do it all yourself.
My 7-year-old seems to have days at virtual school that she breezes through. Many days, though, she struggles to get through, to get through the school day all day long. She's a great student. How can we get her through the rough days easier or more easily?
Okay, I hate to be a broken record. Okay, on those days, what's going on? Okay, is the child hungry? They had trouble sleeping? Is it the teacher they don't like or the course they don't like? But you want to ask, you want to try to find out what it is, not just say, oh, this is a general program, we're just going to make you feel better. Okay, and then come up with a program. Again, do you talk to the teacher? Do you say, gee, on that day you were doing such and such? Maybe can they have a one-on-one with the student and sort of break out to make that personal connection more. Tired, hungry, whatever, and then why? Okay, what's going on? And don't assume that, you know, well, they're there all day with the Zoom. Well, why those days and not other days? Try to figure that out.
Okay. Let me see if I have any more. Can you please comment on seniors in high school missing so many important memories and also doing the college search, which many can't do, of course, go in person?
Like one word, it sucks. Okay, it's horrible. Okay, this is the time of growth and doing stuff. I was on a Zoom with the soccer coach from Georgetown. He was talking about the freshmen, and there's certain freshmen are in town that can see each other, and there's other freshmen that miss the experience. It's awful, but again, kids are adaptive. If the parent panics, oh my God, my kid can't go to school, it's horrible, whatever, you got to take a year off. The parent's reaction will help the child's reaction. And I think Georgetown was very good in trying to get the freshmen back on campus, knowing that transition was key for bonding. They couldn't do it, and they weren't able to do it, but they were going to try to do it safely. A lot of these schools going back, I think it's too early, and every neighbor we have, almost every kid, they're coming home already. One girl was in a sorority, and 8 of the 9 girls tested positive. So parent being calm and trusting in the kids. Kids are resilient. They may do better than us. The soccer team, the kids were starting to bond. They were starting to connect with them, knowing what they're dealing with, and it's a weird situation. They don't know when they're going to be able to play soccer again. This is their life, and connect with their friends. Kids are resilient, and they do a lot better than we think they do.
Yeah, I had that experience. My son just graduated from high school, and he's a freshman here at Georgetown, and losing that last semester and all those big moments, no prom, no graduation, no final, all those moments of being in school. And it was a process like everything of dealing with the disappointment and then the acceptance and then bonding to friends through the process and making the most of what they did have. So it was actually really heartening to see them come through it in a positive way and just accept what was.
Yeah, it's interesting. Provost Groves just did a thing about faculty needing, he does a blog, and he did a thing about faculty needing to be very creative and figuring out how we deal with this. And it's interesting that the medical school, everything is Zoom for the first 2 years, if you believe that. It's kind of hard to do anatomy, hard to examine people, but I'm doing an interviewing course on Zoom. And interesting, they had breakouts. They had meetings before where there's 200 new students, okay? They would break out with faculty in smaller groups to connect and talk about what it was like. So we need to be creative. I thought when I did Zoom online interviewing with medical students, when we used to go to the hospital, would never work. It's been like 98% as good, and in some cases better. Not the same, but they got actor patients. We need to be creative. We need to think about outside the box. One joke about that is there's a Facebook thing where they talk about Netflix, $129 a year. Facebook, $20 a year. Hulu, $120. Harvard, $70,000 a year. Okay. Universities are going to have to adapt. Okay. We have to teach and find out how we do this stuff and still have the on-campus residential experience to, as Jack DeJoya says, have formation and teach people formation. But we got to be creative. You can't do the same old thing.
I agree with you. Well, Bill, I'm gonna turn it back to you to wrap up and share any resources you can with us.
Okay, thank you all for good questions. I hope you get some direction. When in doubt, don't be afraid to ask for help. Stay calm in front of the child. Okay, Kelly, can we put up the summary statement there? Thank you, Kelly. Oh, it disappeared. Can we re-put it up? Okay. Sound like a broken record, right? Summary. Primary factors in the child's coping are the parent-child relationship and how the parent copes, number 1. Number 2, balance hope and honesty in dealing with feelings. Key to coping from passive into active. We talked about the cosmic yoga and the relaxation. That's doing something you get control of. With younger children, don't just keep asking Johnny at age 5, how do you feel? How do you feel? Look at the drawings, look at the activity. Okay? Kids don't just talk about things. Don't adultomorphize again. Ask, tell, ask, listen. Don't run away from topics like death or loss. And in doubt, normal versus abnormal, seek help. And remember, kids are resilient. We can go to the next slide, Kelly. Resources. Reach out to people that know you and your family. pediatrician who knows kids and families very well, your teacher, your school counselor, a pastor, a faith leader, the librarians. Librarians are my best resource to help parents with younger kids because there are tremendous books out there that they know about, like this 10th good thing about Barney, that are amazing. And kids can do that. Distances, it isn't just you talking to them about what's going on. Mental health professionals, reach out to the American Academy of Child and Adolescent Psychiatry. There's a link. They have things called Facts for Families. I don't think they have one on COVID yet, but just about depression, anxiety, what's normal, what's not normal. And reach out to if there's a medical school department in your area of child and adolescent psychiatry. The child and adolescent psychiatry at MedStar Georgetown is wonderful. They've got great resources, psychologists, psychiatrists. If you have a question, ask. If a kid won't go see someone, you can ask for the help. The next one, Kelly. There's the resources. The paper that I did many years ago, which still has some developmental importance, children's reaction. The COVID-19 psychological well-being, that's the pediatric paper. The facts for families. There's a PTSD, COVID, resources for managing stress in COVID. Tips to stay focused on your online classes. There's a group called Casita, and I just ran into this again 2 days ago. The College Counseling Center at Georgetown, Career Counseling, sent out this link, which is for college students, which we haven't talked about much here, except how difficult it is, that shows them how to work with virtual online stuff. Parents and teachers distant learning during COVID, a snapshot from Tulsa. That's a study which we should be very proud of. Dr. Anna Johnson has been doing the study, again, studied pre-COVID and now with COVID, finding out how the teachers and kids and parents are doing. Further reading, these are old books, but very good in terms of some of the articles. Child and Death by Showalter, Anticipatory Grief. Is there another slide or am I done there, Kelly?
That's the end of your slides.
Okay. If I could say one word, and Julie may want to say some closing, but thank you for doing this. I hope I didn't bat you over the head with my insistence on thinking about certain things, but hopefully that'll stick. And one thing that's interesting, Dr. Deborah Tannen, who you may know, who like you just don't understand, she studies language between men and women. She actually gave a talk a month ago, her latest study, and she uses students to gather these things. They looked at emails that people wrote pre and post-COVID, and I think it's very telling what she found. Pre-COVID never started with how you doing, okay? Guess what? Now most people start their emails, how you doing? Pre-COVID, at the end, it was, hey, see you later, good luck. Now, most of the time, we write, be safe. So different times. Be safe, everyone. Thank Georgetown for what it's doing and all this stuff. Julie, thank you.
Thank you, Bill. And I'm sorry for the noise. I am out on the corner of 36th and O, and there's been work outside on the streets for the past couple of weeks during these COVID days. But it is great to be here with all of you. And thank you for your time, Bill, to have this discussion with our community. Thank you to all of you for joining us today to take part in this conversation. And look out for an email from us, please, which will include the resources and references shared today from Bill, and for more information on our upcoming programs, as well as a feedback survey and link to today's recording. So we're grateful for you being here, and Hoya Saxa.
Go Georgetown, Hoya Saxa, and be safe.
Be safe.